Before we begin, as we gather here today, it's vital we also remember the peoples who'd gathered here for millennia. This is the Treaty 7 land of the Indigenous peoples of Southern Alberta, the Blackfoot Nations of 𝗪𝗪𝗂𝗂, 𝗵𝗂𝗵𝗂𝗀, 𝗂𝗀𝗄𝗂, the 𝏉𝏂𝏄𝐿 First Nation, the Stoney Nakoda Nations of 𝗍𝗂𝗄𝐵𝗏𝗄 and Wesley, and the historic home of the Northwest Métis and Métis Nation of Alberta Region 3. It is with the goal of reconciliation that we acknowledge the land on which we gather, and we thank the elders of these nations for their timeless contributions to this land. Today, we welcome Elaine Munce, Director of Community Hospice Services, Hospice Calgary Society. Elaine has worked for 23 years as a registered nurse in a variety of practice fields in Canada and Australia. She completed her Master's of Social Science in Counseling in Australia and returned to Calgary after 15 years overseas. She's worked for Hospice Calgary for 18 years, both as a family counselor and in management. As Director of the Community Hospice Services, Elaine supervises the amazing team who support families living with life-threatening illness, death, and bereavement through counseling and group programs. Elaine, the end-of-life process and dealing with grief is difficult at any time, but this has been a particularly difficult year for people who've lost loved ones. Tell us how Hospice Calgary can help to ease people through their journey and provide support for their loved ones.
Thank you, Colleen. Thank you for that wonderful introduction, for having this spring into 2021. I have to say that I totally missed being at Kerby Centre in the fall for the resource fair. We've been doing it for years, having a table there, and I missed seeing all of you in person, giving you a candy at the resource table. We'll do what we can today to help to still share our information in the different way that we are. And yes, Merry Christmas to all of you. It's snowing heavily outside my window here in 𝗪𝗏𝗏. So yes, thank you, Colleen. I have been with Hospice Calgary for 18 years. We've seen a lot of changes over the years, and this past year, absolutely. Our programs like yours at Kerby Centre have gone virtual. Things have gone sideways. Some things have been a blessing with having gone virtual, and that we've been able to support caregivers in their homes in a different way than we did before. How I wanted to start today really is to give an overview of hospice and palliative care in the city and urban area, because some people think because we're Hospice Calgary that we administer all of the hospices in Calgary, but in fact we don't. We were just the first hospice in Calgary 30 years ago. And so we have been providing in-home support. That's counseling, professional counseling support. All of our team have master's level of qualifications, and we have over 200 volunteers in the organization. But there are 7 residential hospices in Calgary for a total of 104 beds. And so when I say Calgary, I also mean urban area, which is down in 𝗪𝗏𝗏𝗏, which is the Foothills Country Hospice. And I'm sure that many of you are familiar with hospice. You may have visited a loved one there. You may have visited a friend there. You may volunteer in a hospice in Calgary. And some of you, it rarely happens, but it does, that people have actually been admitted to a hospice and then discovered that they have more life to live and may have been discharged from a hospice. So hospice care is aimed at the last 12 weeks of life. And as you know, prognostication of how many weeks somebody has left to live is, it's based on statistics and illness indicators, but you can't measure the will to live. And so sometimes people outlive that, or they live longer than that 12-week prognosis. It doesn't mean that you're going to get kicked out of hospice if you don't die within 12 weeks. But that's kind of the benchmark, right? When you look at how close to end of life is hospice care appropriate. And of course, there's many factors. There are 104 beds in Calgary. We're actually the best served city in Canada for hospice beds per capita. And so the wait to get into a hospice is actually, it varies, of course, but it could be anywhere from about 4, maybe 5 days. Sometimes I've even had people go on the wait list and they're in within 2 hours. So you never know. It just depends when there's a death and there's a bed available in the city. So people who are at home get first dibs, per se, at getting into a hospice bed. And people who are already in a facility would be the second choice off of the wait list. And people who are in the community, living in your home, wherever that home is, need to be on the palliative home care service, which is run by Alberta Health Services. So you need to be assessed through the palliative home care service, and you need to be on their caseload. And if you're not on their caseload, you talk to your doctor, or you can actually phone them at 943-1920 to Community Care Access. And it's basically home care, and someone will assess. But generally, it's best to get your doctor, your physician, to call if you're at the palliative stage of your life where you can use some additional support and care. And then people are in a hospital, they each have a palliative consult service. And so again, the palliative consult service is consulted, and that someone will come and do an assessment and determine whether you are ready to go into a hospice or whether you might go back home again to die. About 75% of people hope to die at home. And of course, when we're supporting people towards end of life, we look at the options. What is best for you? What are you wanting for your family? Who do you want around you? And really doing that end of life preparation and care. And of course, making sure you have all of your paperwork in place with your goals of care designation, your advanced care planning. And I know that Kerby Centre is excellent at educating all of you about advanced care planning, and have had some amazing sessions about that. And if you haven't attended, again, you can either, if you have a home care nurse, you can talk to them. You can go onto the AHS website, Palliative Care. There's tons of information there for you to look at. So having said that, I'll tell you that after, because some really good news about visitation in hospice I was just sharing with Colleen. So I'm going to tell you that after. So going to Hospice Calgary, I'm just going to share my screen now, Colleen. So as I said, Hospice Calgary was the first hospice in Calgary 30 years ago, and we are the only hospice that has the breadth of services where we have a residential hospice, which some of you may know or have been to, which is called Rosedale Hospice. And we also have another center of care, which is down in Deerfoot Meadows. You can see that our mission is to help families and individuals support hope and well-being through compassionate end of life and through death and beyond for bereaved family members for as long as needed. The home care nurses and the Tom Baker Cancer Center always say to us, we love what your organization does, because we're one-stop shopping. Essentially, we do education, resourcing, system navigation, whatever it is that people need for that family. And there you can see Rosedale Hospice, 𝐒𝐩𝐫𝐻 Centre down in Deerfoot Meadows, the Children's Grief Centre. We're actually the first point of referral in Calgary through our Children's Grief Centre for children, teens, and their families who have experienced a death due to homicide, suicide, and accidental death. So we are the first point of referral. As a community member, as a family member, if you hear of anyone who's had a death in the family or an impending death in the family, please do call us, because a lot of people aren't aware that through our Children's Grief Centre, we do provide those services. And through counseling and group support for children. And then as like today, we do a lot of education in the community as well. Our services are accessible for anyone. We don't turn anyone away. Do we have a sliding scale for service? Yes, we do, because we are a not-for-profit hospice and we're reaching out to funding. For our community hospice services, and those are the programs that I'm talking mostly about with you today, we don't have a sustainable funder. We're not funded by Alberta Health Services. And so we're always looking for corporate, individual, and private donations, and constantly working with the government to try and get government contracts. So between our two centers of care, Rosedale, 𝐒𝐻 Centre, 3 centers, Children's Grief Centre, we have 80 employees, 473 volunteers. Couldn't exist without the volunteers, just like Kerby Centre. You guys are a machine with your volunteers, and we are the same. We're the only hospice in Canada that's accredited for giving continuing education to professionals. Rosedale Hospice, some of you may have been there before. As I said, it's a 24-hour care. We are unique in that we are a cancer-specific hospice, and that actually has to do with the bylaws in the area of Rosedale when the hospice opened. And that probably will never change, but 80% of people who come to our organization are actually dying of cancer. And so there will always be a need to have, a higher level of cancer people beds available for people with cancer. The other 6 hospices, they serve any illness of any kind, and we are the smallest. We're only 7 beds, as you can see. We're a big old house. Used to be a residence for priests, and before that it was a shelter for women. And it's beautiful. It's not really identifiable as an institution. Some people say that's the part they like about it. When you are ready to go into hospice and you are seen by somebody through the transition service, whether it's home care, whether it's in a hospital, you don't actually get to choose, unfortunately. You can say, I want that one. But what Alberta Health Services does say is that you can choose the top 2. And most people would put their first preference for a hospice in geographical relation usually to where their family lives, to make it easy for their family to visit. So there are 3 in the north, there's 3 in the south, and there's a couple in the middle, sort of Southwood. They're all not-for-profit hospices, except the private company Intercare owns Southwood Hospice and Chinook Hospice that are central in the southwest, kind of around Glenmore and Heritage Drive. So 24/7 care through Rosedale. It's beautiful that the chef goes around to all 7 beds in the morning, and lunch and dinner, to find out what people want to eat. So she prepares very specific meals for each patient. Foothills Country Hospice does that as well, and down in Okotoks, and it is a great gift that we hear for people. And family members obviously can bring food in. Family members can stay and visit. We have pull-out recliners in all of the rooms for people to stay. And the exciting news that I had just shared with Colleen is I called up to Rosedale this morning because I know that the visitation rules are changing all the time in the hospice with COVID. And I was told some really good news, because this has been so difficult for families in the last 15 months. But the visitation rules have just changed so that each patient can have 4 visitors in the room at one time. 4 visitors in the room at one time. And if they're all from the same household, there's no limit to the number of visitors in the room. Now, they all have to be masked and have social distancing. So the rooms aren't massive. Unfortunately, we're not the Hyatt. So we're kind of small, but it is good to know that those options are available now for the patients. And I've told you about the Children's Grief Centre, which is actually situated where the Community Hospice Services. But as I said, we go out to the community. We're the only, besides home care, we're the only organization that goes to people's homes, hospitals, hospices, schools. We see kids at school and we see kids at home. We are the leading agency in Community Hospice Services. The Palliative Home Care Service through AHS, they have a very small 5 social workers for the whole city of Calgary. So we really do augment their services, and we're really seen as the professionals in working with families. And our counselors have family therapy backgrounds, psychologists, masters of social worker. So the social workers will send complicated families to us, or families that they know that need bereavement follow-up after the death occurs. If there are adults only in the mix in the family that are needing support, we need to see them before death occurred. We can't provide just bereavement support after the death occurred, because Alberta Health Services Grief Support Program, or the Bob Glasgow program, they are the ones who serve adults after a death. So that is one thing to remember. We don't intake adults only. After the death. After the death, we will support children, teens, and their families due to any cause. And before the death, there needs to be, we need to see the adults before the death if we're going to support them after. That sounds very confusing, just the way I said that, but you can ask me again and I'll say it again later. So Community Hospice Services, we support people of all ages and their families who are facing any advanced illness. So, you know, sometimes people are diagnosed with an illness, but they're not expected to die from that illness. And they may not know from the time that they're diagnosed. And so it's a moving target. We say to people when they call in to us for service, we say, are you looking at preparing your family for the end of your life? because usually when you narrow it down to that fine point, then people say, oh, okay, yeah, this service is for me. But if they're not thinking of dying from this illness, generally it's not an appropriate referral for us because we are a hospice. Tom Baker Counseling Center, Cancer Center does counseling for people with cancer, and ALS does counseling for their disease group, the Cardiac Function Clinic. So there are different groups out there if you're not expected to die, but we do serve all illnesses and all ages. And our counseling now, like your services at Kerby, we're on telephone, we're on Zoom, and we are still seeing some people at 𝐒𝐻 Centre if Zoom isn't working for them, particularly children. Sometimes they struggle with, we have play kits with the kids, and the counselor has a play kit, and we've done some amazing things with supporting them over COVID. But sometimes there are some that we still just need to see them in person, but we're very limited. Our support group, Living with Cancer program, I'll talk a little bit more about later, is online weekly. So it's for adults who are living with advanced cancer and their family members. And our community hospice services, these are our goals: build coping skills, strengthen caregiver and whole family resiliency, reduce social isolation, improve quality of life. And I'm sure that each one of you listening to this presentation says, yeah, we want to do that our whole life long, not just at the end of our life. So as I said, we do individual and family counseling. During pandemic, we're on Zoom, wanting to prepare for end of life. So our weekly Living with Cancer program, as I said, is for patients and caregivers where they have advanced cancer. And we used to, in previous times, be a 4-hour program on site at 𝐒𝐻 Centre in Deerfoot Meadows from 10 till 2. So you got a full lunch, complimentary therapy right on site during the program. We have education, we have entertainment, fun. I would say our programming is sublime to ridiculous. Sometimes we're serious and sometimes we're fun. And I really think that this is the fine blend of this program. We won a National Impact Award from the Canadian Cancer Society for the programming. And it's not all about serious, it's about living life fully until your last breath and then being able to support your families afterwards. And it is a wraparound program, so that people who join the Living with Cancer program have telephone support during the week as well from our counselor, and spiritual care is involved in the program. One thing new when COVID started is that we connected each client in that program with a volunteer. So because of the isolation of COVID, because of the global grief, really, that has hit all of us through this pandemic, they were finding that the patients and caregivers were needing more support. And it's turned out to be a wonderful program. And I think Kerby Centre is also doing the same. If I'm right, Colleen, you're doing some phone contacts. I know that the Calgary Seniors Resource Society has upped their volunteer contact to like 400 volunteers phoning people every week. And so that's worked well for the people in this program as well. And when we were on site, we had complimentary therapies. Now we're not doing massage on Zoom and reflexology and healing touch. Some of the volunteers, when they've been calling the clients from the Living with Cancer program, this is some of the feedback that we've had from some of the clients. One of the ladies said, my volunteer picks me up when I'm feeling down. One other lady said to me, oh man, when that volunteer, she calls me, it's better than any shrink I ever had. And this lady said that the Living with Cancer program has loved her back to living. So we've had some pretty profound, and you all know what group support can do. And when you have peers who are going through a similar experience to you today, or with you in this moment. And another client said, my volunteer and I solved the problems of the world today through their conversations. And sometimes it's ordinary conversations, sometimes it's more serious. And they may say, look, why don't we get Stacey, the family counselor, to give you a call if there's things that need to be addressed. And then we have our Children's Grief Center that I referred to. It's been branded a couple of years ago and needed to be, because if you had a death by homicide or suicide or accidental death, coming to a hospice wasn't really a fit for you. So we have groups, Kids Club for 5 to 12-year-olds, which has a parent component. Common Ground is our teen support group. And the Village is our group that's a monthly therapeutic, it's a recreational group. So all the families come together and they have fun, but it really does help the young children who've experienced the death of a parent at a young age to see that I can still have a fulfilling life, because a lot of the mentors in the Village program are teenagers or budding psychologists who have all had a parent die as well, or a grandparent or a sibling. In fact, our practicum counseling student that we just started last week, she came to us, her father died during the flood when she was a teenager. And she came through our programs, she was a mentor, she finished her psychology degree, and now she's a practicum counseling student with us. So that's kind of how it goes. When you come to Hospice Calgary, people tend to become a real member of our family as groups. And as I said, our Kids Club, these are all set, they're 8-week groups. They're different. The Living with Cancer program runs year-round, 52 weeks a year, and these are 8 weeks group. The Kids Club, we run it about twice a year. We used to be 3 to 4 times a year sometimes in the past. And then the Common Ground, again, is for teens. It's an 8-week group. They don't want their parents to come. They don't come with parents. And then the Village, as I said, it's more of a drop-in group. As I said before, we do a lot of education. These were our stats numbers from 2019. 2,400 individuals who attended our education sessions. Dying to Know was one of our most recent education programs. I don't know how many of you may or may not have attended. And I have a lineup of about 14 seminars. It says 12, but I switch it up throughout the year. And they are monthly on the 3rd Tuesday of every month from 6 till 7:30 on Zoom now. And I have a real lineup of professional presenters. It's become so popular. When I first launched it in March of 2019, on site in that year at 𝐒𝐩𝐵 Centre, we had 250 people. And as through the pandemic now, we've had 1,000 people register for this program. And so you all know how wonderful the Zoom platform has allowed people to attend education and get services that they may not have before. It's been a real godsend for caregivers who can't get out of the home, as you know. To register actually for Dying to Know or for any of our services, you can go onto our website, and I'll show it up later. It's hospicecalgary.ca. Volunteers, 12,000 hours of volunteer service through every organization. Direct client care at Rosedale, 𝐒𝐩𝐵 Centre, Children's Grief Centre. We use volunteers through all of that. As I said, we're not funded in our community hospice services. Our children's services have a contract through Alberta Mental Health. That's actually new after 30 years of service in the community. We just got a contract with Alberta Health Services and FCSS. One of our newest resources, and again, you can go onto our website at hospicecalgary.ca, is Life's Last Chapter. We just finished this. We launched it externally a few months ago, and I can't believe how many orders that have had in for copies of this. And it really is a resource that prepares families and patients as well for those last weeks and months of life. It's, I said, complimentary copies across the province to hospice societies, and there's been a huge uptake. So have a look on our website. You can buy a PDF copy. You can buy a bundle of copies if you want one for each of your family members, but it's been very popular. And we're also on social media, and there's all of our links there. I see we don't even have our email on there, hospicecalgary.ca. We have a lot of resources on our website as well for caregivers, advanced care, planning, tips. I've tried to up the information for caregivers on there after some feedback from a client. So go have a peek, see if there's something you can find. There's information about talking to your grandchildren or children, about living with a life-threatening illness, and yet lots of other resources on there for parents. And I think that's me done. I think I had until 10:40, but look at me, I'm done early, and maybe I talk fast. My apologies.
We have lots of time for Q&A here now then, but yeah, great information. Thank you very much. Lots of good information imparted there in a short period of time for you. And one of the things is that you're absolutely right in referring to the volunteers are invaluable. I think one of the most important things that we've all discovered this past year is trying to stay connected and trying to make sure that particularly our older adult community, but in your case, people, the families that are dealing with the passing or imminent passing of a loved one, and kind of feeling like they're alone out there. So staying connected has been very important. So it's great that you've got such a good volunteer contingency and lots of great opportunities like the Dying to Know. So it sounds like some good resources there for people to sign up and get information.
Yeah, the Dying to Know, I always send a survey out the day after every month. And it was interesting because the goal of that program when we launched it was really to expand the breadth of our reach, right? Because primarily before, our education was with professionals, right? That we would get people coming to workshops for us for a day. And that was starting to peter out. Alberta Health Services was restricting the time that people could come, school boards restricting the time, so school psychologists. And really the goal to expand, to build compassionate communities. About 50% of the people who attend are volunteers working in the community and churches, any organizations across the city. There are family caregivers, there are patients who attend, and there are professionals. My suspicion is most of the professionals are people who don't work in hospice and palliative care. So that's been the demographic of the people who've been attending Dying to Know. And I'm just so excited about that, because that was, you know, when you build a new program, you don't know if people are going to come and play in the play box with you, in the sandbox, right?
Absolutely. I'll invite anyone that has any questions. We've got a couple coming in here, but I'll invite anyone that has any questions. You're welcome to pop them into Q&A or the chat buttons on your menu, or if you'd like to ask in person, if you have the capacity to hit the little raised hand, and we'll try and unmute you. In the meantime, Barb has asked, do volunteers receive some training before helping in the area of need or interest?
So yes, Barb, thank you for your question. So all volunteers who work in hospice or palliative care across the city in any site, whether it's a hospice, whether it's a hospital, whether it's in home care, Alberta Health Services, the volunteer service has a palliative volunteer in-home visiting program. When they started, they had 20 matches between volunteer and patients. And when I contacted them just 2 weeks ago, they had 80 matches between volunteers and patients. So every volunteer who works in any site across Calgary, wherever that is required to join. It's called the Alberta Health Services Palliative Care Training, but in fact, all of us contribute to the presenting sessions in that. So say Hospice Calgary presents on the family dynamic session in the palliative volunteer training. And it's a Friday night, a Saturday, and a Sunday, I think, from I remember. Of course, it hasn't run now for 15 months. I've forgotten how quickly I forget how long that training is. But yes, so that is available to everybody. And then for our services, we do provide individual support and training for the counselors as well. One of the programs, and I forgot to mention, actually, I must add this to my presentation, is bereavement telephone support. So that's a volunteer program that I coordinate. And we provide support to families from Rosedale, where someone has died if they weren't connected with us before the death occurred, but they got connected with us at the hospice. And then, of course, those volunteers would come into the bereavement telephone support program, where they're calling the family members monthly, right, for as long as needed. And so I do individual training with those volunteers, as we do with the volunteers who are working in one of our children's programs. I should say, actually, that the teen group is now on virtual as well, as is the village. We haven't been successful in launching the kids group yet on virtual. So yes, long answer to your question, Barb. The Catholic Diocese also used to do a training for palliative and hospice care volunteers. And again, we were a part of the content of that. Alberta Health Services Grief Support Program contributes in that. So we're a very close-knit community in Calgary when it comes to hospice and palliative care. I connect with all of the palliative care social workers across the city. There's about 20 of us that work in all different sites. And so we host at Hospice Calgary, we host those quarterly meetings with them. So there's a lot of sharing and education. And as I say, we're very close-knit. Brian, you've asked, is there a cost? There is a no cost to go into any hospice. Years and years ago, the provincial government picked up the $30 a day per diem that used to be in existence for people who went into any hospice, but that's not a requirement anymore. Generally, most people are able to apply for Palliative Blue Cross. If there are any additional costs to, say, medications, but there are some medications that aren't fully covered. But most people qualify for Palliative Blue Cross. And if you don't have that already, when you arrive at a hospice will help you to apply for that. And so all the hospices are the same. Yeah, there's a little bit of there's maybe some medication costs. Sometimes oxygen is used in hospice. It's not a very common intervention to use oxygen. So depending on the oxygen needs, there may be a small cost to oxygen supply. But again, these are nominal costs, and again, they're covered, right? So yeah, Palliative Blue Cross generally covers those.
We have a couple of questions here in Q&A as well. Can you please walk us through the typical timeline or process for making a decision to enter hospice?
Well, so everybody is different. I think that there are family members, sometimes people are admitted to a hospice because of caregiver burnout or family burnout. And it really is it's a decision that's made between physicians, right, in home care or in hospital, family members, caregivers, the wishes of the patient. Sometimes what we see is if the patient is young, they don't want to see their children going through that very end of life stage, right until their last breath in their bedroom or their living room if they have a hospital bed at home. And so it really needs to be a conversation between the patient and their family members, and it can be a really tough one, because for those of you who are caregivers, you know that there is guilt. There's feelings of isolation. Many caregivers want to be able to care for their person until they die, if that's the wish of the patient, is to be at home. And so, that's where our services can come in as well, because we have a lot of people where we just see the caregiver as well. We don't even see the patient, perhaps. So helping them to cope with those caregiver needs. And the process, as I said, it really is if the patient is unable to maybe get out of bed safely, is having a lot of falls at home, and then they're at risk to both the caregiver and to the patient, right? If pain can't be managed at home, there is an intensive palliative care unit. It's Unit 47 at Foothills Hospital. So that unit is intended for people to go to be admitted for short-term symptom control. So sometimes that's kind of a bridging part of the process, is that a patient might be admitted to what we call the IPCU or Unit 47, and then they might be able to go back home once their symptoms are controlled, whether that's breathing or pain. But sometimes it might not be, and they might end up moving from that unit into a hospice from there. So there's many factors, but just to know that it isn't just about what's happening with the patient, it's about what's happening with the whole family system. And, palliative home care, the palliative consult service, they're very good at taking that whole family approach, which is one of the beautiful things about palliative care. And so, if you're never certain, please do give us a call. As I said, you can't just get in. Unfortunately, there's not a doorway to phone one hospice and say, I want to get in. Actually, not uncommon. We had somebody actually call our volunteer manager just a few days ago. He wanted to pay $1 million just to get into Rosedale.
Oh, wow.
And that's tempting, right? To say, okay, we'll take your money, but you can't just pay in. There's a system, right?
Yeah.
Does that answer your question, anonymous attendee?
It's a very individual circumstance. Maureen, thanks for joining us again today. And Maureen has said that a few years ago, a good friend who attended regular SAGE meetings, which she really enjoyed, she was undergoing chemo for cancer and was so upbeat that I honestly didn't realize how close to death she really was. At what stage do people usually sign up for SAGE?
So what we say, and research is really showing that the earlier that you can get support, usually the better outcome you have for yourself. The research actually shows that what they call the term early integrated palliative care actually improves people's quality of life because it's a focus. It's about preparing yourself. And so if you know that, sometimes Tom Baker says we have nothing else we can do for you, right? Or say you've got cardiac disease, and you know that you're at end stage. Typically it's the caregiver that sometimes knows those other diseases because they're much harder to predict when the end of life is approaching with renal disease, lung disease, or cardiac disease. But if you know that you're not going to survive this illness and you want to be with other people who understand what you're going through, then that is the right time to sign up for services through us, whether it's the group support you're talking about, the Living with Cancer program, Maureen. And I dearly wish I knew who your friend was, but you can send me it secretly if you want. I'm very connected with that program as well. And yeah, that's the criteria, right?
Yeah, Maureen can reach out to you personally there. What is the criteria for deciding between home care and going to hospice location, and when?
Well, as I said, most people want to stay at home as long as possible. And certainly that is the goal of our psychosocial services. We don't provide hands-on service because Alberta Health Services, through the Palliative Home Care Service, contracts that kind of hands-on, medication administration care to private companies, in-home companies, right? CBI, one of the big ones. And oh, sorry, what was the previous? What's the decision?
What's the decision making? Like, how do you make a decision between hospice care and home care?
Most people start with home care, and when home care is not sufficient to meet your needs, and some people will die at home. Their family, there takes a lot of people to get 24/7 care.
Yes.
The Palliative Home Care Service doesn't provide 24/7 care endless. You're entitled to, now I shouldn't really give a number, but honestly, you're entitled on the Palliative Home Care Service to get approximately 25 hours of care, right, in a week. So that's not 24/7 care. And so people generally need to have a family or friends who can step up. And that's part of the support when you're reaching out to somebody else for support, like Caregivers Alberta, ourselves, 𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵𝗵 You know, we can do things like help you set up a schedule, right, for care and who's going to come into care. But when things get to be too much, then that's when you're looking at going into a hospice. And if your service providers in the home are saying, you know, you've got about 8 weeks left to live, and are we going to be able to hold this up for this whole time? Are you getting the best care you need? If your caregiver's burnt out, once people go into hospice, caregivers say, oh my gosh, I can just be his wife again.
Yeah.
I can just be her husband again. And I don't have to focus on, bathing, being safe, trying to lift up, giving medications. That's usually what we hear when people go into hospice.
Mm-hmm. And that being what you take away with you afterward is, at least being able to have had that experience of spending the quality time. So,
Right.
and Maureen has also said she was familiar with Foothills Hospice as well, and has good things to say about that as well. And yes, her sister did not have the opportunity to pick or choose. So
I would have to say that the hospices, All of the hospice in Calgary have a contract with Alberta Health Services. So Alberta Health Services gives some money for operation costs. I mean, we still have to fundraise for the rest of the care expenses. But because Alberta Health Services has a contract with all 7 hospices, we are all in the residential areas, we're all required to follow their policies and procedures and their incident reporting mechanisms. And all of the hospices regularly attend, all the hospice directors regularly attend meetings with the other hospices and Alberta Health Services. So what that does for, for peace of mind for all of us in Calgary and Okotoks is to know that there is a standard regulated area of care. And actually, Alberta Health Services, many years ago, 8 years ago now, required all of the hospices to be accredited through Accreditation Canada. And so ours is just coming up now in November, that dreaded accreditation.
I was going to say, that's quite a rigorous process.
This is our 3rd time around, but you have to have the proper care, and they're involving families and clients more in the standards that they're looking at. And so I have to say that whatever hospice you end up in, you're going to get good care, right? Do things go sideways sometimes? Some types of pain might be a little bit more difficult to control than others. But the most important thing I can say to you is to always talk to your healthcare providers. If you're not sure of something, if you have questions, if you ask for the social worker. Every hospice has a social worker. At Rosedale, we connect with the 𝐒𝐻 counselors, my team, to provide that support there. But we also have spiritual care on site. So there is the level of care in hospice. Most people say that, wow, this is amazing, right? Mm-hmm. Are there enough beds for the whole city of Calgary? No, but not everybody wants. 75% of Canadians want to die at home. So we're doing pretty good, I would say.
It's also gives pause to realize that, you need to have the conversation. People need to be free to talk about it. There needs to be more facility for people to have the good experience that they would get in a hospice. And that I've had my own personal experience, and I can tell you that the people like yourself and the people that are working in these hospices, caring for the patients and the volunteers, are a particularly amazing type of person to be able to give that quality of life to someone at the end of their life, and then just to be able to let go of that. It takes a very special person to be able to provide the kind of quality care that you do. So I have to applaud you for that. So
I do have to say to Maureen, I see the name of your friend. I remember your friend very well. What an amazing person, and how blessed are you to have called her your friend, Maureen. I remember her very well. Her and I used to have amazing conversations together, and she wore the most beautiful colors, didn't she? Anyway, I also forgot to talk about MAID. Are we out of time?
We got a couple minutes here.
Okay, so people sometimes, I'm surprised nobody asked me about medical assistance in dying. Mm-hmm. And Hospice Calgary and all the hospices support people who are dying by any means. People tend to think when MAID first was legalized in 2016, and it was very difficult, certainly one of the biggest changes in my career, my professional career. It's becoming more commonplace now, and Alberta Health Services has a wonderful website that you can go and check out MAID. How many people have received MAID? What is the, just Google Alberta Health Services MAID, M-A-I-D, and medical assistance in dying. And you will find out the criteria, the registration process. If you need phone numbers, give me a call. I didn't put up my email. Should I be putting up my email?
If you want to pop it into the chat box, and people can,
I will do that. Yeah.
And just make sure you do all panelists and attendees, because sometimes it just goes to panelists.
Yeah.
But that way,
that there's no exclusion of people who are dying by MAID. The hospices have different processes. Some of them have a faith-based background. And so they have, maybe the person has to be transferred somewhere else for the provision. But the MAID team, the hospices themselves do not administer the medication to make the patient dead. There is a navigation team from Alberta Health Services that comes into the hospice once the patient has been approved through 2 independent assessors. So that's kind of how it goes. So yeah, as long as people fit the criteria, there is access to medical assistance in dying in all the hospices now in Calgary.
Wow, wow.
And at home, there's a lot being done at home, but as well for navigation, people going into the home.
That's great strides have been made there. So yes, and I see now you've got it to all panelists. If you don't mind, but do you mind typing it in again and just click on your 2 and it'll say panelists and attendees.
Sorry.
That's okay. Otherwise, our guests won't see that. It's just coming to me and I know how to find you.
Yeah, so any questions you can call, actually even just call 𝐒𝐩𝐫 Centre 403-263-4525 at 𝐒𝐩 Centre. Our intake, we have an intake coordinator. We do community presence. We do community responses. If there's been a death in the community soccer team, whatever it is, you know, we do attending to those as well where we can. So.
All right, there we go. That's better. So everyone should be able to capture that information if they like, and I would highly recommend that you reach out to Elaine if you have any further questions. Elaine, thank you very much. This has been very informative. It's always a very difficult subject for people to have to face and talk about, but very important. So I really appreciate your information and we look forward to having an opportunity to connect again, hopefully next time in-house. And
I hope so. I'm going to go back to Kerby Centre and share chocolates and candy and conversations with all of you in person. I just hear such rich stories at the resource table and I'm missing all your stories now.
Absolutely, absolutely. But I think that we have all concluded that even when we are allowed to go back to live, we'll still continue to do these kinds of online. So look forward to working with you again. Jenny's great presentation and energy, and Brian, great presentation and information. Thank you very much.
Thank you, Colleen, for inviting me.
You're quite welcome. Everybody enjoy the rest of the day and stay warm.